As we know, there are 12 cranial nerves. You should go through them thoroughly from the first cranial nerve to the 12th cranial nerve. These nerves are olfactory nerve, optic nerve, oculomotor, trochlear, trigeminal, abducent nerve, facial, vestibulocochlear, glossopharyngeal, vagus nerve, accessory nerve, and hypoglossal nerve. First, we start with the olfactory nerve. To examine the olfactory nerve, you should get a non-irritating common odor, and you should ask the patient to smell it in each nostril separately. Remember, it should be a non-irritating odor. محمد الآن أبغى أعطيك أشياء تشمها. هي أبغاك تغمض عينك وتشمها، وأبغاك كل مرة تستخدم يعني جهة من الأنف. طيب الآن أبغاك تغطي لي اليسار. أيوه، حاول خذ كذا شمة كذا واحدة.
اوكي. فانيليا.
فانيليا. طيب الآن الجهة الثانية. قفل أيوه وغمض عينك. This is a different item to smell. شو محمد؟
Coffee.
Coffee. So he has a normal smell in both nostrils. Next will be the optic nerve examination, which has 5 components that you should examine: visual field, visual acuity, color vision, pupil response, and fundoscopy. I will start with the visual field. In order to examine the visual field properly, you should have an item that has a red cap and should be transparent. You may use a pen with a red ball at the top, and you can also use your fingers, but it's better to use any item that has a red color on a transparent stick. To examine the visual field properly, patient should have no glasses. You should be at least 1 meter or an arm stretch away from the patient. You have to examine each eye separately, and you have to use a technique confrontation, which means your patient's right eye against your left eye. We will do the technique now, and you remember to examine the 4 quadrants of each eye. محمد, so خليك مرتاح كده. He should be at the same level as my level, and the distance is an arm stretch. محمد, غطي عينك اليمين. I will cover my left eye. طيب محمد, always look at my eyes هنا. Don't look anywhere else, just look at my eyes.
Okay.
Don't move your head, don't move your eyes. I will move this thing around the corners. When you see it, tell me I see it, okay?
Okay. I see it. I see it.
Okay. Keep looking at my eye here.
I see it. I see it.
Now, the other eye, you should cover your left eye. I will cover my right eye, and again I will examine the 4 quadrants of his right eye.
I see it.
See it, yeah?
I see it.
Keep looking at my eye here.
I see it. I see it.
Okay, thank you. This concluded the visual field examination, which was normal. Next will be the visual acuity. You should use a Snell's chart, which is a way to examine near visual acuity. You can find it should be at the same size. You can find it online. You can print the same size on a paper, as long as it will do the job and it has the same size. Now we'll examine the visual acuity. Mohammed, do you have any glasses?
No.
Okay. Now I will do, I need you to cover your left eye. Okay. You have to hold the Snell's chart at least 25 to 30 centimeters away from the patient. You should have a good illumination in the room. Mohammed, then you can hold it. This is a good distance. Mohammed, اقرأ لي, should you read the first line at the top?
E.
E. طيب, go down.
F. T.
كمل.
L.
اقرأ مع بعض كده.
L. B. E. D.
Okay, carry on. تحت.
B. L. E. O.
Okay, and green line and red line, this is the normal range. I'll get him to read this letters here. أحمد اقرأ لي تحت الأخضر هذا.
F. E. L. O.
Okay, last line اقرأها كلها ورا بعضها.
D. E. F. P. O. T.
The visual acuity scale, at the side of the line he was able to read. You should start with the first line, big line, and then you go all the way down to the line that he should be able to read. If he makes any mistakes or unable to read any line, you should go up to the line just before that, make sure he read it smoothly, and then the reading of that line will be his visual acuity. So Muhammad's visual acuity was 20/20. He was able to read the all lines all the way down to the smallest one. And this is 20/20 of the right eye. I should now do the left eye. Muhammad. Okay. So he's able to read the whole lines, even to the smallest one on the left eye, and the visual acuity is 20/20. So he has a normal visual acuity in both eyes, which is 20/20. Next is color vision examination, and you have to examine each eye separately. You may use Ishihara plate, but at the bedside you don't have to have it. You can simply use any color, that is the red, particularly the red, and you should compare the red saturation in each eye separately. Look at, is it red?
Yeah.
How about now? Still red?
Yeah.
Is there any difference?
No.
Does it look any different in any eye?
No, it's
It is the same. Next is the pupillary response. You should use any source of light. You can use a torch. Make sure the light you are using is a strong light, and you should examine each pupil separately. Look at the distance.
okay.
Okay. Now, I should direct the light in each eye separately, as I'm going to show.
Okay.
This is the direct light response of the right eye. And I can see a normal pupil response. Now we'll do the same for the left eye. Good distance. Make sure you show the light very quick and you take it off very quick. You can also swing the light between each eyes to look for the direct and indirect. Hamid, look at the distance.
Okay.
Other variation of technique, you should put a splitter so the light will not spread from one eye to the other one. And it is the same thing. Direct on the right, direct on the left, direct on the right, direct on the left. You can also, and you should look at the indirect pupil response. I will now examine the indirect response of the right eye. Look at the distance. My right light will be very faint, but the direct light should go to the left eye. I'm looking at the right eye. The right eye is constricting, dilated now. Constricting, dilating. So this is the indirect of the right eye. I should do the same now for the left eye. So now I'm going to examine the indirect response of the left eye. This is my tangential light. Muhammad, look at distance. I'm looking at the left eye. And I can see the good response of the left pupil when I shine the light directly to the right eye. So next I will do the examination of the oculomotor, trochlear and abducent nerve. So that are 3, 4 and 6 nerves. We lumped these 3 together because they are controlling the eye movements. When you examine these 3 nerves, you should start with inspection, and then you do the eye movement technique, which are the H technique. Sometimes you may use the X technique, and finally you have to do accumulation. I will start with inspection here. محمد كده relaxed. ايوه. لا تسوي حاجة أنت. أنا بس أبحث الوظائف فيك. So if I want to inspect the 3, 4 and 6 nerves, I have to look for ptosis, abnormal eye movements, such as nystagmus, or any eye deviation. You may also need to comment about the pupillary size, if there are any pupillary asymmetry. So these are the major components that I should look at when I examine these 3 nerves by inspection. My next technique will be the H technique, looking for the extraocular movements. Hamad, don't move your head. Only I want you to follow my finger with your eyes only. Here I don't need to have any glasses. So and the distance is the same as about arm stretch or 1 meter. Don't move the head, only move the eyes. Follow my finger. Start at the middle, and then I go to following an H letter. Make sure you go to the extreme of gaze. Make it like a big H. Follow, follow. تمام. You may see few nystagmus, few beats nystagmus. These are physiological nystagmus. I mean, you need to lift the eyelids so I can look at the eyes going down. طالع طالع تمام 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 طالع follow yeah. Again, I'm going to the extreme of gaze. You may see a few beats nystagmus, but that is okay. Go up all the way, and then I go down. Follow. I go all the way down, and then I go back to the midline. So by each technique, I looked at the eye movement, at the all muscles, and he has a normal extraocular movement. My final technique is to do the accommodation, looking for conversion and pupillary constriction. Follow with your eyes, don't move your head. So you should come from a distance, and then you come closer to the patients. Follow. So there is conversion, and if you look carefully, there will be some pupillary constriction. So, thank you, Mohammed. So these are the way to examine the 3, 4, and 6 cranial nerves. My next examination will be the trigeminal nerve examination. It's a little bit a complicated nerve, as it has 3 components. There will be a motor, sensory, and reflex. If you are organized and if you follow a system, you should have no difficulties performing the examination. The motor part of the trigeminal nerve is the examination of the muscles of mastications. The sensory part is through examining the facial sensation, and then the reflexes are the 2 reflexes known to be done by the trigeminal nerve. I will start with the muscles of mastications. These muscles are the temporalis muscle, the masseter, the trigoids, both median and lateral. I will perform the examination now. I want you to relax, okay? Just look straight at me. Okay. So I will start with inspection. So by inspection, I will look at the temporalis muscle in both sides, and I don't see any wasting. I don't see any fasciculation or any abnormal movements. Now, and I'm going to feel the bulk of the muscle, which is another way to look for muscle wasting. عض على أسنانك. clinch. ارخي. عض مرة ثانية. So I can feel the bulk of, thank you, I can feel the bulk of the temporalis muscle on both sides, and it looks normal. Next I will do the masseter. Ahmed, relax. The masseter is a very like a longitudinal big muscle, so you can feel it if you ask the subject to clench in the teeth. Ahmed, relax. And I can feel the muscle that should be coming longitudinally from top to bottom. Okay, so I can feel the masseter. They look both symmetric on both sides. Now we'll do examination of the trigoids. So by jaw opening, these are the trigoids muscles. There are median and lateral trigoid. They will help to open the jaw. محمد الآن حاول الحنك move side to side. Exactly. So this is a way to examine the trigoids again, both median and lateral, for the side to side movement of the jaw. You can also apply resistance to assess the power. محمد حاول كذا. ايوه قاومني. تمام. The other way. قاومني. تمام. So these are the muscles of mastications, the motor part of the trigeminal nerve, which is a normal examination. So he has a normal motor component of the trigeminal nerve. Next exam will be the sensory examination. The sensory examination again is the sensation over the face. Remember, the trigeminal nerve will cover the face through 3 divisions, which are the V1, V2, and V3, or the ophthalmic division of the trigeminal, maxillary division, and the mandibular division. Usually, we should examine each division. You have to compare side to side. You should know the anatomical landmarks of each division. I will not go through them now, but at least I will do the sensory examination of these divisions. You can use either the fine touch, you may use temperature, you may also use pinprick, like a pain sensation. Avoid to examine the vibration, because vibration will go through the bone and it will just give you a false information. So you can use touch, temperature, or pain. I'm going to use the touch, and I'm going to use like a regular tissue paper. Muhammad, um, I'm going to examine the sensation of the face. Always when you examine the sensation, you have to give a patient a standard, like a way to teach him what is the sensation you're expected to feel, and then you go to examine the area of interest. So I will use here the chest as my control. محمد تحس هذه؟ تمام؟ تحسها زي ايش؟ touch مش كذا؟ So now محمد أبغى تغمض عينك. I will do the exam on your face, okay? So I ask him, I did the standard, and then I get him to close his eyes. Sensory exam should be done with eyes are closed. And then I will examine each side separately. I told him I'm going to examine the face, so he won't be surprised with what I'm doing. So this is V1. Hasina?
Yeah.
Hasina?
Yes.
You look the same?
Yeah.
Tamam. The way I'm doing it is screening, so I'm not going to really go through the landmark of each division, but I'm going to examine each division like a spot area as a screening for the exam. Eyes closed again. Hasina?
Yes.
Tamam. Hasina?
Yeah.
You look the same?
Yeah.
Tamam. Now the last division. Ahmed Hasina?
Yes.
Tamam. Hasina?
Yeah.
So this is the sensory part of the trigeminal. Again, I examined V1, V2, V3. I was doing screening. I compared each side to the other one. I use again the touch. You can use any other sensory modality. My last part of the sensory of the trigeminal nerve examination is the reflex. For the trigeminal nerve, we do have two reflexes that you usually examine. You can use these are the corneal reflex and the jaw jerk. I will do the corneal reflex if you don't mind, Hamad. Okay. So for the corneal reflex, I will do each eye separately, and I will look for the blink response of each eye. Hamad. Now I will do the right cornea. Remember, it's a corneal reflex, so you should make sure that you hit the cornea. You don't hit the sclera, the white part of the eye, because it is not scleral response, it's a corneal response. So hit the cornea. Hamad. So I get him to look away from my target, because I don't want him to blink just because of the threat that he sees something coming toward him. So look away. Ahmed, look there. Oh, sorry. So I touch the right cornea and both eyes closed. Now I will do the other eye. Ahmed, مزعج الاختبار بس سامحني. Now Ahmed, look away. Look away. Again, I don't want to come in front of his face. No, I should come away. He should look away from the area I'm approaching. Thank you, Mohammed. So I examine the corneal reflex of each eye, and he has a normal corneal response bilaterally. I will do now the jaw jerk. Relax, Mohammed. اسمع, افتح فمك شوي كذا. Open it. Make it a little bit more. Yeah, a little bit more. Relax. Relax. So I get him to open the jaw. He should be relaxed. Relax تماما. And I hit. So what I'm doing, he is relaxed. The mouth is not forcefully open. It's like a midway open, and I hit the mandible, of course, looking for either a jerk, which should not be an exaggerated jerk, or no response. You can have normal response with no response at all, or like minimal jaw jerk. So these are the two reflexes run through the trigeminal nerve. So overall, the trigeminal nerve is normal, with normal motor, sensory, and reflexes. The next examination is the facial nerve examination. Again, this is a very important cranial nerve that all the students and physicians should know how to examine. The facial nerve examination, as usual, it has three components. There is a motor, sensory, and reflexes. The very important part of the examination is the motor exam, which through which we will be examining the muscles of facial expression. I'll do the exam now on Muhammad. Again, when you do an examination, be organized. I will start from the top and I will go all the way down. So to examine the muscles of facial expression, Muhammad, relax. By inspection, again, I'm looking from the top and I'll go down. Muhammad, lift your eyebrows up. Eyebrows up. So now I'm going to look at the wrinkles. They look symmetric. The eyebrows elevate symmetrically. Yes, relax. And then Mohammed, close your eyes very tight, very tight. Now very tight eye closure. Again, I look at the eye closure, very tight, they look symmetric. I need to apply resistance to see how equal the eye closure is. محمد غمض عينك. لا تخلي افتح عينك. So they look very strong both sides. Relax, okay. Now I'm going down all the way. I will examine and have to comment about the nasolabial fold of each side. So I can see the nasolabial fold, they look symmetric. I look at the mouth, there is no drop of the angle of the mouth. Muhammad, smile. Exactly. So now I can see the nasolabial fold, they look more prominent and they look symmetric. When he smiles, there is no mouth deviation. The angle of the mouth again looks symmetric. Muhammad, open your mouth, get wide. Again, this is another way to look at the facial muscles of the mouth. So again, looking at the mouth deviation. Thank you. Now this is how tightly he can seal the mouth, and when he blows, there is no air leak from one side. Here. So again, thank you. I cannot get any air leaking from any side. So tight mouth closure look normal as well. Again, I keep going down now, Muhammad. Exactly. So now this is the way to look for the platysmus muscle, which go all the way down. This is another facial nerve examination. So by conclusion, he has a normal facial expression, which indicates a normal motor facial nerve. Next exam is the sensory examination of the facial nerve, which is a special sensation for the taste of the anterior two-thirds of the tongue. I will not show the exam, but I can discuss it theoretically in brief. You can get a common taste, usually salt or sugar, and you should get the tongue protruded. You should use gloves and hold the tongue out, and then you put a taste. And without letting him getting the tongue inside again, he should be able to tell you what flavor he was able to taste. This is the sensory facial nerve. The last component of the facial nerve is the reflex or the reflexes, which is mainly the corneal reflex. Because remember, the corneal has the afferent and the efferent component. We are talking here about the efferent component, which is the facial nerve for the eye closure. As we saw before, he has a normal corneal reflex bilaterally in both sides. So this concludes the examination of the facial nerve, which is again motor, the facial muscles of facial expression, the sensory, which is the special taste, special sensation of the taste of the anterior two-thirds, and the reflexes. The next nerve to examine is the vestibulocochlear. As the name implies, it has two components, the vestibular component and the cochlear component. We don't commonly examine this nerve. I will just go through the technique to examine it in brief. The vestibular component is mainly to look for signs of vestibular disturbance. I have already examined some signs for vestibular disturbance through the eye examination that are mainly looking for nystagmus and other abnormal eye movement that can be caused by the vestibular system. So to look for the vestibular component, you may comment about nystagmus when you examine the 3, 4, and 6 nerves. By history, there are other signs to implicate the vestibular component disturbance, but we're here talking about the examination. The cochlear part, which is the hearing, you can either use the Weber or Rene test. The technique for Weber or Rene test is through high frequency tuning fork, but you can also use the 265 or 128. I will not go through the exam technique here, and you can read it more because someone may argue the validity of these two tests. It is not the matter of discussion here, but this is the cochlear examination, i.e. the hearing examination of the cochlear nerve through Rene and Weber. You can do a very simple exam for the hearing. You can whisper at one ear and you can distract the patient very gently on the other ear, looking for if he's able to recognize the whispering in one ear, and then you can do the other side. Next exam is the glossopharyngeal and vagus nerve. We lump these two together because they share some of the features. That's why they are examined together. We do the motor part of these two nerves through looking at the soft palate and the uvula. When the patient say ah, and then I look for the contraction, symmetric contraction and elevation of the uvula and the soft palate. There is also the reflex, which is a gag reflex, and there is no sensory for these two nerves, at least that you can do through our techniques. Muhammad, okay. So now I ask him to open the mouth. I shine some light to look at the uvula. and the soft palate. Hamid, say ah.
Ah.
Okay. So there is contraction of the uvula and elevation of the soft palate both sides. Thank you. And both sides look symmetric. Next, you can do, and you just need to comment about the contraction and the uvula elevation, with no deviation, no asymmetry. For the reflex, you can do gag using the tongue depressor. You should use the tongue depressor to touch the back of the throat in each side and looking for the gag response. I said there's no sensory exam that you can do here, but there is sensory exam, which is mainly the sensation of the soft palate. But we don't do this commonly as in clinical practice. It is mainly the gag reflex that can touch the afferent and the efferent part of these two nerves. Next exam is the accessory nerve. Accessory nerve has only a motor component. There is no sensory, there is no reflex. Now I will show the accessory nerve, which supplies two important muscles, the trapezius and the sternocleidomastoid. I'll examine the trapezius now. محمد relax كده. اسمع ارفع كتفك على فوق. ارفع فوق. نزلها. So this is shoulder shrugging. ارفع مرة ثانية. So there is symmetric shoulder shrugging. نزلها. So shoulder elevates symmetrically with symmetric shoulder shrugging. And now I will apply resistance. محمد ارفع فوق. قاومني. Try to resist me. Resist me. Very good, thank you. So this is the trapezius muscle, which is normal. Next will be the sternocleidomastoid. I will examine the right sternocleidomastoid. محمد بك طلع على اليسار. طلع على اليسار. So this is the right sternocleidomastoid. The function of each muscle is to deviate the head contralaterally. I will apply resistance to see how strong the muscle is. محمد حاول طلع على اليسار. أنا لا تخلي دفيتي على الجهة اليمين أنا. قاومني أنا هناك. So I'm examining the right sternocleidomastoid by resistance, pulling the head to the right, which was very strong. Now I'll do the other side. Again, this is the left sternocleidomastoid. محمد قاومني دفنت على اليمين. This is the muscle, and he is able to resist me with no difficulties, and the resistance look equal in both sides. So it is a normal sternocleidomastoid bilaterally. So this is a normal accessory nerve. The last cranial nerve is the hypoglossal nerve, which is only a motor nerve. It is the motor of the tongue, and I'm going to show the exam now. فهمت؟ الآن اسمع افتح من فمك كده. Yeah. So now I inspect. خلي فمك relax, tongue relax. Exactly. افتح فمك. So this is my inspection. I look at the tongue. I look for any signs of wasting, any fasciculation, or any atrophy or changes that I can see on the tongue by inspection. الحمد لله طلع سنك برا. So I ask him to protrude the tongue. Tongue protrusion. It looks midline. There is no deviation. محمد حاول تحرك لسانك يمين يسار. تمام. So again, thank you. The tongue moves to side. Now I will apply some resistance, more or less, to assess the power of the tongue. محمد دخل لسانك من جوا. Try to hit my finger بقوة. So I'm resisting the tongue, which looks يعني good bulk. The other side. Exactly. Thank you. So this is a hypoglossal nerve, which is only a motor component and which is normal.